Hi students, I welcome you all to this orientation session to obstetrics and gynecology. I suppose I have neonates, infants and toddlers as my audience now who really want to know something about the subject of obstetrics and gynecology. It's very important that you have a good orientation, know what exactly is obstetrics and gynecology. So that really helps you to take a decision about your future and also pay the required interest to this subject. The first thing I always want to tell my students is that this is one of the evergreen subjects of medicine. Why? Ask me why I am telling so. You know, childbirth and pregnancy are the part and parcel of every human life. It deals with physiology. So, can you stop micturating? Can you stop defecating? Similarly, you cannot stop the human beings from getting pregnant and delivering. So, as long as mankind lives, the subject is evergreen. You have eradicated smallpox, we have almost eradicated poliomyelitis. So, things may reach a stage wherein the whole globe is disease free. But can it be pregnancy free? No. That's why I said obstetrics is an evergreen subject and it will never starve its followers. I'm not just supporting the obstetrics. I'm telling you, if someone wants to take up obstetrics, this is one push I'm trying to give you people. It is evolving from the time of Adam and Eve. You name Aristotle, you name Hippocrates, who have started some of the medical aspects, but who delivered Eve? I also go to the extent of telling the first obstetrician must have been a man, because Eve was delivered. Who else could deliver Eve? Must have been Adam, right? So any male listener who is little reluctant to take up obstetrics and gynecology, try to understand the first obstetrician was a male probably, right? So obstetrics has evolved from that time, and the Greeks, Romans, Egyptians and Indians had evolved their knowledge so much in obstetrics and gynecology. Unfortunately, those are probably in the books now to be explored yet. 16th century onwards, we had the idea of instrumental delivery in the form of forceps, but totally under the custody of a family called Chamberlain's family, right? So this Chamberlain's family kept this secret for almost 2 to 3 centuries. Later on, people have learned the art of instrumental deliveries, and Ventus took almost another 100 to 200 years to evolve. 1950 onwards, because of Maelstrom, you have the development of instrumental delivery in the form of Ventus. The safety of the mother was one of the important aspects, and the safety of the baby was kept aside in earlier obstetric practices. So, whenever there was some problem to the mother, they never insisted upon caesarean delivery. They used to wait for vaginal delivery. In this bargain, most often the baby would have a death, intrauterine death. Then many destructive operations for transfers like decapitation, then craniotomies, spondylotomy, many destructive operations were devised. But now it has gone to the backstage. It is only history. No destructive operations are being done. I'm just talking about the evolution of obstetrics. So basically, obstetrics deals with pregnancy and childbirth. It could be normal or abnormal. 85% of the deliveries would have no problems. Pregnancies will have no problems, but 15% of the deliveries in pregnancies could be high risk. And these high risk pregnancies require so many obstetricians that the present 45 to 50,000 obstetricians in India would be inadequate to manage the 30 million deliveries that are happening in India. So there is a dearth for obstetricians, and it is high time that more and more obstetricians come up, right, from a batch like yours. Interventions done during pregnancy and delivery are the other things that are learned in obstetrics, and of course neonatal problems and management also comes under the purview of the neonatal and newborn problems also comes under the purview of an obstetrician. What are the prospects? Is it a dead end subject? Many people say I took obstetrics because my degree ends there, MS. I need not go for a DM, MCH, etc. No. Now you have subspecialties. Let me really not use the word super specialty. Let me say subspecialty. You have a great subspecialty called fetal medicine, wherein you have got a lot of interventional procedures that are done in pregnancy, and you can even treat the baby in utero. What else you want? You are a pediatrician, you are a surgeon if you become a fetal medicine expert. High risk pregnancy management is the other challenging field, and really the gratitude that you get at the end of managing a high risk pregnancy and sending home a mother with a healthy baby is equal to nothing on this earth. Obstetric ultrasound. Someone wants to really think, why should I take obstetrics? I have to struggle throughout the day and always throughout my life. No, many people who have practicing obstetric ultrasound work between 9 and 5, do a great job as sonologists and end their practice. That is another prospect you have in obstetrics. Of course, if you really love obstetrics, you want to have the adrenaline surge in your body and enjoy that surge, enjoy the palpitations, take up the routine obstetrics and continue managing the obstetric aspects. Coming to gynecology, it deals with diseases of female genital system. Here I'm not talking, we are dealing with physiology. It is another branch of medicine which deals with diseases, not at ease, it is disease. Endocrinology and fertility aspects, oncology, different treatment options in cancer, radiation, chemotherapy, etc. Urological problems in the woman, they prefer to come to a gynecologist than go to a urologist. Contraceptive practice is one more great branch that is associated with gynecology, and of course the most fascinating and the money making field, probably the endoscopic surgeries, right? So very lucrative branch of gynecology. So what are the prospects? You can expertise in infertility, right? Again, do a great service to the sad, unfortunate infertile couple. Endoscopic surgery, as I said, you can expertise in laparoscopy, colposcopy, and hysteroscopy. Do a great job for the needy people, the keyhole surgery and cosmetic surgeries, etc. Gynaecology, the unfortunate cancer victims, give the best way. Gynecologists are the best ones to treat cancer of the female genital system than the general oncosurgeons, right? So always gynecology has a special space in the field of gynecology, right? Gynecologist, yes, you can expertise, deal with all the pelvic floor disorders, urinary disturbances, even some of the bowel disturbances that happen due to the pelvic floor problems all come under gynecology. Adolescent and pediatric gynecology. Lot of problems in the adolescent group, lot of problems in the children because of gynecology, lot of sexual abuse and problems associated with childhood sex abuse, psychiatric issues, and amenorrheas, the endocrinological issues, all those are very fast coming up super specialities of gynecology. Family planning and contraception, one could be an expert, and there are special contraceptive clinics and situations in which you are a dilemma, the contraceptive expert will be able to help what is the best type of contraception for your patient. So how to study this subject? I told you it deals with obstetrics, deals with normal and abnormal pregnancies. So start with normal pregnancies, learn the antenatal care, what are the events that occur in pregnancy, how you extract the history from the patient, how to individualize the examination in obstetrics, and diagnosis of labor. When do you say that my patient is going to deliver? Give the exact time of delivery. You will be appreciated like anything, like management of labor and also understanding the mechanism of labor. Know everything about abnormal labor. This is the next thing that I want my students to concentrate upon. Know the normalcy first, then learn the deviations, go to the abnormalities of labor like malpresentations, malpositions, problems associated with the passages, then preterm delivery, multiple pregnancies, then placenta previa and abruptio placenta, which account for the antepartum hemorrhage, cord abnormalities, cesarean delivery, and something about cesarean hysterectomy also. Some conditions unique to pregnancy: antepartum hemorrhage, hypertensive disorders, liver disorders like AFLP, that is acute fatty liver of pregnancy, and intrahepatic cholestasis of pregnancy, gestational diabetes, unfortunate intrauterine fetal deaths, induction of labor, and prolonged pregnancy. These are some of the unique conditions that you have to study as a unit. The next unit would be abnormal pregnancies like abortions, ectopic pregnancy, gestational trophoblastic neoplasias, and also you should know about termination of pregnancy. So for this, the fetal anomalies that are associated when you decide about termination, the legal issues in obstetrics, that is sex determination issues which are legally forbidden, and also the Medical Termination of Pregnancy Act of 1971, which are being amended from time to time. That knowledge also is very important. Ultrasound examination and detection of anomalies and abnormalities is very crucial, again for the well-being of your patient, the baby, and also to protect yourself from the legal hassles. Fetal growth restrictions, gynec disorders in pregnancies like fibroid uterus with pregnancy, carcinoma cervix with pregnancy, prolapse with pregnancy, ovarian cyst with pregnancy, etc. HIV infection, a very big challenge for the obstetrician. Medical disorders, all the system disorders, one should be aware, and how to tackle this woman. So totally obstetrician takes the role of a physician, takes the role of a super specialist while managing pregnancy with systemic disorders. And the undergraduate student should have observed, should have conducted certain things in obstetrics department. And I tell you students, this is one department you have the ample opportunity. You should work 24 hours round the clock on at least certain days to get exposed to all kind of events that occur in this department. So conduct at least 5 normal deliveries, conduct 5 episiotomies, give 5 episiotomies, and learn the suturing technique under supervision. Cesarean delivery, forceps, ventouse delivery, cerclage. Try to observe a few cases during your postings in the obstetrics and gynecology department, and if you don't get an opportunity to observe, you have to go on some night duties and try to observe these procedures and learn IV line placement, catheter, urinary catheter placements, and it is better you do it yourself to have a feel of it and do it. This is going to help you a lot when you go for your rural service and when you want to independently practice, or in the event of you taking up obstetrics as your specialization. Preoperative and postoperative management, personally, if you look at and try to do yourself, connecting IV fluids, giving IV injections, and talking to the patient, counseling them, it's going to be very helpful to you. Newborn care, at least 5 resuscitations you should observe, because obstetrician is the first neonatologist that would be attending the patient. And also I tell you, you have taken care of the mother for almost 9 months, and whatever that happens to the baby, the first thing, the first account of it comes to the obstetrician, and then only she goes to the pediatrician. So beware, be good in certain aspects of pediatric practice also. Obstetric ultrasound examination, the anomalies, and first trimester ultrasound, and preferably a couple of transvaginal ultrasound visualization is really desirable for an undergraduate. Coming to gynecology, You study the genital system, pelvic anatomy, menstruation, ovulation, gynec history taking, and special things about gynec examination. Be very sure about the speculum examination and bimanual examination in gynecology. Cancer screening procedures, endoscopy application in gynecology, and something about genital infections you should be aware. Infertility and oncology, a detailed uh, review of these two topics should be made by the undergraduate. In fact, an undergraduate is also supposed to discuss a case of infertility in the examination as a case discussion. General gynecology, displacements, AUB, fibroids or any other benign tumors of the uterus and ovarian, endocrine problems, uterine anomalies, and the intersex problems. Many a times we get women or the girls with indeterminate sex. So clitoromegaly, absent vagina, or inguinal hernias, which are nothing but the testicles sitting in the inguinal region in case of androgen insensitivity syndrome. So these things you should be learning the next. Coming to the procedures that are desirable, always do pap smears. Initially observe and at least do 5 pap smears. Endometrial biopsy in the OPD you have to observe, which is done with a pipel, or you can also go for the classical DNC examination and observe them. Cervical biopsy, colposcopy, hysteroscopy, laparoscopy, and these things should be observed, and a couple of vaginal hysterectomies, a couple of abdominal hysterectomies should be observed by you to be aware of how exactly the procedure goes on, right? Ectopic pregnancy and ovarian cyst. If you work 24 hours on the duty, right, you may get a couple of ruptured ectopics operated as emergencies, ovarian torsions that are operated. These things are possible only if you work off your duty hours in the night. Probably you can choose a Saturday, stay in the night in the hospital, observe all the cases. Sunday will be a holiday, you can go and relax. So this kind of practice is desirable from an undergraduate. Now coming to what books to study. We usually prescribe some undergraduate books like Datta's textbook of gynecology and Datta's textbook of obstetrics. Normally, most of us recommend these books for study. They are very good, and if you are thorough with these two books, probably you can expect more than 80% in your examination. Shaw's textbook of gynecology is another alternative for gynecology, and Essentials of Obstetrics and Essentials of Gynecology by Lakshmi Sheshadri, Professor Lakshmi Sheshadri, is one more book that you can really consider to enrich your knowledge in obstetrics and gynecology. Mudaliar's textbook of obstetrics and Bhaskar Rao's textbook of gynecology are other very valid textbooks that an undergraduate can really have it as a standard textbook for them. War Rounds in Obstetrics and Gynecology, which has been co-edited by me, published by JP Brothers, could be a good source of information for your clinical examination and to really attempt the examination with lot of confidence. This book could be of some help to you. Right? Now these are the books that you need to have as a standard textbook for studying, and if someone is more interested in the subject, they can refer Williams Obstetrics and Williams Gynecology. You can go to Hysterectomy Made Easy if you want to know expertise in surgeries, and Medical Disorders in Pregnancy by Pankaj Desai, both of which are published by JP Brothers, and Gynec Endocrinology by Leon Spiroff, Novak's and Berek's Gynecology, Teelindes Operative Gynecology, High Risk Pregnancy by Fernando Arias, Operative Obstetrics by Munroker, and Problem Pregnancy by Ian Donald are some of the books in which, if you have time, if you want, you can refer. I can understand a student who has to study so many subjects in his MBBS may not have time to refer these things. So listen to your class lectures, listen to the sessions that we have made it a part of this particular program, in which we have involved senior teachers to teach on subject. So only after referring to multiple textbooks, the sessions have been designed, and it will be of lot of use to you if you follow these things. So finally, I would say the aspirants, the followers, and the ones who have to read obstetrics and gynecology, it is a part of your curriculum. So you cannot be done without obstetrics and gynecology. And one word of caution, students, unless you expertise in the practical obstetrics, once you go to the peripheral places to work in rural areas, to work as during your bond period in various hospitals, you may find it very difficult to handle cases, because the input to most of the PHCs, CHCs, or even general hospitals, 30 to 50% of the input is obstetrics, and at that time you cannot just expect someone to come and help you. So become really aware of and be equipped with the knowledge, skill, and a good attitude towards the subject of obstetrics and gynecology. Thank you.